We will limit that number, etc. That is, I'm talking now, not about now, I'm talking about the potential widespread outbreak. So don't press the panic button yet. But we need to prepare. We've got a window of opportunity.
Yeah, okay. All right, thank you. I think probably because the Premier has made an announcement, you might want to ask questions around that. Because whilst we are inside, we are not talking about the case. We are only talking about what is happening inside. But understandable that some of the questions might be answered by Dr. Smith or Dr. Engelbrecht as well, especially on around the tracing of the contacts. Over to you. The questions first. Wait, we have to manage this. Okay, I've got you. Okay, I've got you. But let's take 5. 1, 2, RT3, 4, 5. Yes, okay.
Hello. Good day, I'm Nathan Sal from Network 24 and the Local newspaper. Can you just tell us where the patient in Western Cape went for testing and if they are in fact in this hospital or where they're being treated?
As far as I know, private facility testing, but then quarantined for 48 hours while they were being tested. And as far as I know, they're actually at home in self-quarantine. Am I correct?
I think we know the same amount of information.
At home in self-quarantine.
Okay, can you tell us where in Western Cape?
No. I don't know. I don't know where they live.
Is it possible to tell us which countries the patient is traveling to, and also why is he home at the hospital?
Okay, so I know. I mean, I can't remember exactly. It was across Europe, travelled through Europe, returned to Cape Town on the 9th, but presented himself because he had symptoms to a private healthcare institution. Obviously, that then triggered tests because we have medical protocols. There was then a quarantine space for 48 hours while obviously the tests, as I understand, and then from there self-quarantine while this person has to work through the virus itself.
And why is the person not here?
I don't know if I can. I mean, I know that he's not sick. He's just presented with the symptoms. Correct?
Maybe Dr. can comment on that.
Yeah, I can just say, I mean, we prefer not to admit people unnecessarily to hospital. Again, if it's extra a risk on the hospital, and the person doesn't need to be in hospital if they are not that sick. So it depends on the clinical picture. If the clinical picture of a patient changes at home, then obviously we will admit them for medical care. But at the moment, there is, and it's also in the statement that will be released, there's 2 options. You can quarantine a person, that is, in other words, had high-risk contact but not ill at all, and monitor. And you can isolate people, which is when a person has symptoms and you want to kind of not put them into contact with other people. That can be either symptoms waiting for your test, or symptoms being confirmed being positive. So then you can isolate. You can self-isolate at home, and there's procedures from the WHO and the NICD of how to do that, where it is possible. And then you can be isolated in hospital if you are sick enough to be hospitalized.
Maybe I can add to that. If you remember, I don't know if you saw that article written by the doctor who dealt with the first case that presented in South Africa. The doctor and the nurse that worked with that first case, they are both fine. But they have self-quarantined after it was found that this person actually did have the virus. So then the doctor and nurse who worked with that patient self-quarantined, and she said she's still fine.
Premier Acting General from Newsroom Africa, what more information do you have? Do you have to know whether this person is traveling alone? Do we know the flight the person took? And you mentioned a general hygiene. The Western Cape has been hard hit by a drought. How do you presume people continue with the restrictions around usage of water in Wisconsin?
Okay, that was an interesting question. So obviously I don't have all of the details of the flight, etc., but there are protocols. So that's why the national minister makes the announcement, because once it's presented, those protocols have to kick into place. The national minister, and through that system and the Department of Health, what will happen is they will then start to have a look at who that individual came into contact with in the last while. So we know that this person came back on the 9th. they would have had a look, they would have traced it right back to even the seats either side of them on an aircraft, etc. And then those protocols, and that's why I think so far we've tested over 3,000 people in South Africa already, because you actually need to go and test everybody that you've come into contact with. And I mean, we've only had so few cases. With regards to the hygiene and the water, it was an issue that I raised more than a week ago at a PCF with all of our municipalities, to say that we need to go back and check, because in many of our areas, because of the drought, we're still years later running really strict protocols with hand sanitizer. Half the taps in the bathroom are closed off. That we actually looked at opening a few more of them to make sure that we are following proper hygiene protocols. And I mean, I think that, and you've heard it today again a few times, I think that's the most important message that we need to get out to everyone in our country and in our region, that just follow proper hygiene protocols. If someone is, we get colds and flu all of the time. Let's continue, even with colds and flu, that we don't go to work and cough all over everybody, and follow those hygiene protocols.
Clarity, Premier, are you saying you're opening up more taps?
Yes, I'm saying that make it more available so that you can wash your hands properly. The minister will tell you, she makes sure that you wash your hands, at least count to 20 while you are soaping your hands, so that you know you're getting a proper wash.
Are you loosening up the restrictions?
That won't be loosening up the restrictions. It will just be where we have restricted water flow in certain public spaces. Let's make sure that we have not just one basin available, and hand sanitizer, that we have a few more basins available.
The next question is from you, but before that, because I know that people are interested in this particular case, but what's important, as we always say, that you identify and then you contain through contact tracing. So I want Dr. Smith probably just to say something about how do you ensure in terms of tracing the contacts, because that's important, before so that we don't repeat the same question.
Can you come closer?
So, yeah, good morning. So, as we speak...
A little bit more closer, please.
No.
Towards the center.
So, as we speak, contact tracing is in place. We're working with the airlines, we're working with colleagues from AXA. It's systems that we've been testing and putting in place with lots of the other cases that we wanted to test. So it's not something new at the moment. I think I'd also like to just add on what the Premier was talking about, the important work that's going to be happening now with the 7 groups. And that is a whole of society approach to try and get public transport sanitation sorted out, just to improve systems on a day-to-day basis. And when I briefed the Premier on Monday, if we take up, what do we do when we wake up every single morning? How do we go through our day? How do we exercise? Why don't we start working with all these people to make sure we have a safer and cleaner environment to work in on a daily basis? But the contact tracing, as we speak, we're busy with it and working very closely with the airlines and all other relevant role players.
There was a question.
My question was going to be on the number of contacts involving screening of this patient.
We won't know because they are still busy with it, but you have seen in the KZN cases where others might have 20 or 15, it depends. As the Premier indicated that the person has been a traveller, so it means that it might not only be from the plane when he arrived from South Africa, it might be in others as well, just to give an alert to those outside South Africa. But as the Premier has indicated so far that he was diagnosed at a private hospital. So it's likelihood, if he is ill, he might go to the private hospital. But what is important is a containment of the tracing, which is what they are busy with right now.
And sorry, just on which date did he arrive back in Western?
So he arrived back on the 9th, so 2 days ago. But what I can also say, and I want to maybe follow on with Dr. Smith, I want to say that these protocols and procedures have been in place for a while now in this country, and I want to commend them. We had a lot of international arrivals over the weekend where people came to take part in a bicycle race. It was interesting in the communication I was getting for people who'd been traveling around the world, saying they could not believe how professional, and it was actually better than they'd seen anywhere else, the kind of processes that we've got in place here as well. So I really want to commend the teams that have been out there for the last few weeks at our airports, at our ports, making sure that we're putting that first stage risk mitigation in place. And then the number is over 3,000 tests have been done with 7 confirmed. So it shows you that really in-depth processes are in place to make sure that as much risk mitigation is put in place.
How many tests in this province?
Oh, that I can't tell you either.
Okay, so we'll come back to that. Can we have, yeah.
Just from SABC, Vanessa, I've got 2 questions, maybe one to you, NEC, and then one for Premier. The first one is how many people, if any, are currently being held in isolation here at Tygerberg Hospital for screening, etc. And then, Premier, perhaps for you, I think we touched on the measures at ports and so on. And I'm talking purely from an economics point of view. The tourist cruise terminal, can you just tell us what's happening there? And also the harbour is a major point for cargo as well as fishing vessels, how that process is being managed. Thank you very much.
Okay. For the first question, yeah.
So the first question, as far as I know, because it changes every day, in the Western Cape we've tested more than 80 cases. And more or less a third of those is from Tygerberg. Just to show you that our healthcare professionals across the province are informed, they are testing and they're taking up the responsibility to be part of the bigger team of managing cases.
Are anybody in isolation at present?
Oh yes, yeah, we at the moment have 3 beds occupied. And all people are not very ill, but because we're in the containment phase, we decided to admit. Everybody cannot necessarily also self-isolate. So we're waiting those tests and they should be available today.
So how long does it take to after a swab to confirm a test?
Okay, so that obviously depends on how busy the lab is in terms of how many cases they need to process. But the test itself does not take too long. It takes about 12 hours. So usually we would tell people, it's actually shorter than 12 hours, but we'll tell them 12 hours, just to also take into account the fact that there may be a long line of tests that needs to be done. And we would tell a person that comes in that they could expect the result in about 24 hours. Because it needs to be validated as well.
But I can, before I give it to the Premier to answer the other questions about the ports, just to indicate that port health is the responsibility of the National Department of Health. But we work together because once now there's a case, once now there is a person who has been identified to meet the definition, it's when now our team gets activated and go and fetch the person. And then secondly, for media purpose, coming for testing is not an issue. Actually, we'll encourage, if you meet the definition, whether you have traveled outside South Africa or you have been in contact with a person who has traveled coming from those high-risk cases, you can volunteer. There's an 0800 number, that is a national number, where you can ask for more details. Or you can even self-isolate, plus also come for testing. Because we don't want an issue where the media now camps outside in this area, wait for what are the results. Because even those 3 that are inside, the national minister will make an announcement if there's any other positive case. And then it goes to the cabinet, to the Premier and ourselves before. So you don't have to wait that what is the outcome of those cases. It's not a big deal for people to test. We want people to come to test, but we don't want you to inundate the hospital. And also for Western Cape, you can go for testing for the swabs in any health facility. It's not necessary to be in Tygerberg, but mostly it's people who have met that definition. You can go anywhere else. Whilst it is the site for the quarantine and so forth, but anyone can go anywhere, private doctor and so forth. So that is crucial, that is important.
Minister, how many other facilities have been compared to just like Tygerberg in terms of quarantine wards and etc.?
Remember, it's the first time that we have got a positive person now, and as the Prophet has indicated, that it's a work in progress. So whilst Tygerberg has been identified as one of those, as according to the National Department of Health announcement, but it doesn't mean that the next one won't be Kalbrima or the Grooteskill. But remember, it's not the first time that we are having communicable disease notifiable or such cases. Remember, we used to have H1N1? And we have had some of the outbreaks at the time. So it's not like that out of the blue we have got in our quarantine wards. That's what we're supposed to do anyway. But what we're trying to highlight is that for the Tygerberg, which has been identified, we are ready for it. But it doesn't mean if there's a patient that's been identified in Beaufort West, that Beaufort West cannot be prepared to be ready for such.
Minister, can we intervene? So, colleagues, as I indicated,
To answer the one
just
question.
want to ask one question. Okay. Just running out of time.
So again, and the answer to that question, we spoke about the Joint Operation Command, the working groups. So there's an economic working group that is working on what do businesses need to do, what are events, conferencing. There's a whole range of economic activities that happen in the province. There's a working group on education. There are 7 different working streams. They are all working on building scenarios, what happens when, and that's why we are here today actually, is to come and have a look at the readiness of Tygerberg and the quarantine space and the readiness of, but as the ministers just said, this can happen anywhere in the province. Of course, we are getting ready, and that case that was announced today by the minister is not even here. But you know, I also want to just reiterate for a last time that if you, the citizen, feel that you feel a cold coming on, that doesn't mean you need to ask yourself the question: have I been in contact with international travellers? Have I travelled internationally? Then the next thing you must do is you mustn't all rush to your clinic. The next thing that you should do is phone that hotline that the minister spoke about. It is the hotline that will take you through a whole range of questions that will then say to you, please just quarantine yourself and monitor, or actually because you've been in contact in this area or whatever, they will advise you. That is an 0800 029 999. I'll say it again, 0800 029 999. If you yourself are worried, contact that call center number. They will advise and help you. And then if you've got a cough, follow again proper hygiene processes and quarantine yourself.
The age of the
Okay, I
patient
think
was identified?
no, it's already there in the statement. But okay, yes. But now what's going to happen? I'm going to hand it over to Dr. Dimitri, who will be the last person to speak, so that will take us through how it's going to happen inside.
So, colleagues, as I indicated earlier, we have 2 legs to this visit. The first leg is taking you on the patient under investigation from this entry point into one of the isolation areas where the patient heartbeat ends up. So that's the first leg. The second leg will provide opportunities for questions and answers in the boardroom. So please keep any other questions you may have for that session. I will appreciate that. Also, the ward we're taking you into now is Ward D10. That ward is fully operational with patients in. It's our infectious diseases ward. There are 3 cases, persons under investigation in the isolation unit, which has got 4 beds. Okay? In that isolation unit, there are 4 rooms. Each of those rooms have an ensuite bathroom. Okay? So it's quite a high-tech with negative pressure area. So we'll be taking you there, please. We'll ask you, we're taking you in 2 groups in that area. It's going to be quick in and quickly out, because there are patients in that ward. It's an operational ward at the moment. Okay? After that, we will take you to our second isolation facility, also a 4-bedded unit, where there are no patients in the moment. That unit